dummy.
Dale, un dummy.
Go, girl.
Imagine for a moment, if you will, that you're walking along the beach, maybe in Florida, and a body washes up along the shore. The area is too large to be covered by a lifeguard or two. In my case, it's after 5 and there are no longer lifeguards on duty. Would you be able to perform a life-saving procedure? Cardiopulmonary resuscitation, otherwise known as CPR, is a rescue procedure often performed when someone undergoes cardiac arrest or is unresponsive. This procedure keeps the oxygen and blood flowing through the body, therefore keeping the victim alive. I would be lying to you if I said that this wasn't an intimidating procedure, but by paying close attention and with practice, you too could learn to administer CPR and save someone's life by just following 3 easy concepts: proper assessment, technique, and persistence. The first step to administering CPR is to assess the scene. You can't help someone if you get yourself injured, so in any case, always make sure the scene is safe. In the process of doing so, look for anything that could be harmful to you, such as open chemicals, open fires, electrical hazards, or in my case, wild waves that can swallow you up. After you have deemed the scene safe, check your victim for responsiveness. You could do so by tapping them on the shoulders. Bobby, are you okay? Can you hear me? If there is no response, choose a bystander to call 911. You, call 911 and get me an AED. In the case that you're alone, quickly call 911. Put the phone on speaker and the police will proceed to tell you what to do step by step. After you have alerted your bystander, check if the victim is breathing. You can do so by putting your ear to their mouth and feeling for moisture and listening for any breathing. You want to make sure that your face is facing the victim's lower body, so you can look at their chest and stomach for any movement. After you have done so, scan the victim for no more than 10 seconds. After completing this step, you then want to check your victim's carotid pulse. If the victim is not breathing but has a pulse, start doing rescue breaths. However, if they're not breathing and they don't have a pulse, start compressions. Next, watch for your technique. The more efficient you are, the more effective your CPR will be. With one hand, you want to gently tilt the victim's forehead back. With the other, lift their chin and plug their nose. You then want to put your mouth directly over their mouth and start blowing air into their body. Look for rising in the chest. If there is none, reposition the victim. You want to make sure that you're doing 2 breaths per second. Now, if you're starting with compressions, if possible, remove the victim's clothing. You then want to grab your dominant hand, place it over your weaker one, and place it right in their sternum between the breastbone. You want to make sure that you're pushing 2 inches deep and use your upper body strength to exert force to the chest. You should be doing 100 compressions per minute. A good reference to how fast you should be going is the song Staying Alive by the Bee Gees. Here, let me show you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5. Once you start the cycle, you want to do 30 compressions and 2 breaths. Now, don't be alarmed if you hear the sounds of bones cracking. It's quite normal for ribs to be fractured or broken in the process of effective CPR. Lastly, always remember to never give up. CPR can keep someone alive for as long as 2 hours. Persistence is key here. However, if you can no longer conduct effective CPR, find someone who is certified and can take your spot, and continue to administer CPR until help arrives and can take your spot. Nevertheless, you can be the difference between death or life for someone. By just properly assessing the situation, having good technique, and persistence, you can save someone's life in the case of an emergency.
Woo!